At CBD BioCare, we offer several different topical pain creams and even a roll-on that people are using and having great success. Dr. Frank uses some of these products in his office, and he's going to talk about that today. Dr. Frank, we have, of course, the oils that people are using internally, but then we also have these pain balms and the roll-on. So if you would talk about how you're using them in your office.
Of course. So this is one of the things that I would say, gosh, we go through so much cream and so many roll-ons. I can't tell you the good feedback that we get on these products. And as a chiropractor, of course, this makes me happy, right? Because if I can give a patient something simple that they can do at home in between treatments, something that maybe will prevent them from reaching from that extra Motrin or extra aspirin during the day, I'm a happy camper. So with that said, in my offices, some of the most common things we see: knee pain, elbow pain, low back pain, neck pain. My go-to topical in office is the 3.8 ounce jar, which provides 500 milligrams of CBD, and I believe that's in a 10% solution of emu oil. Now, I find that one to be the most effective. Most people I deal with, I know you guys have the smaller size jars, which I believe is 75 milligrams of CBD. Most people I work with, I just tell them, look, let's go right for the 3.8 ounce jar. It's 500 milligrams of CBD. You have the emu oil in there. It's going to last you, I don't know, most of my patients, 3 months, 4 months out of a single jar at $70 when it comes to pain too. That's a very, very effective price point for patients. So more often than not, I see the best results for sure on the superficial joints that are really subject to arthritis. So knees is probably the most popular area. Those arthritic knees, whether we're talking stage 1 arthritis or stage 4 arthritis, it seems to work mostly every time for people as far as some pain relief goes. Elbow, we have a lot of people this time of the year coming in with tennis elbow, golfer's elbow, due to those repetitive motions. CBD oil, the cream, seems to work fantastic for that. And then the roll-on, we use a lot of the roll-on gel when it comes to tension headaches and migraine headaches. I understand there's 100 milligrams of CBD in the roll-on, but a lot of times what people do is apply it to the back of their neck. We'll have them apply it to their temples. And that roll-on seems to be very effective in creating that strong cooling effect that just takes off some of that tension that's usually affiliated with a tension headache or a migraine. But by far, most popular product, 3.8 ounce, 500 milligram. We stock those regularly here, and it's hard to keep them in stock because they seem to be so effective for people.
Have you also had patients try layering? Because we've had some success with, we have some dancers that we know of that actually put the 500 milligram pain cream, which a little bit goes a long way with that. They put that down and then they put the roll-on on top, and you get that nice cooling sensations. Do you have any patients that have been doing that as well?
So I'm really glad you brought that up. It was actually since we had this discussion on migraine headaches, and it was actually after that you had mentioned that you guys had people doing that, and we started to incorporate that, and I can tell you that's gone very well. Again, we've really been using that more in the muscles of the neck and the low back than anywhere else. But yes, I can tell you we have had success with that. Absolutely.
Well, and you had mentioned giving it to patients when they're away from you. So my husband had the same thing. As he gets the tennis elbow, and he's gone to a chiropractor for treatment for that. And then when he sees a flare up, I'm not trying to take business away from you, but what happens is instead of having to go to the doctor, all he does when he has a flare up is he puts a little bit of the roll-on on, and maybe for 2 days, and it keeps him out of the doctor's office, right? So that's a good thing.
I completely agree. Listen, at the end of the day, I love having patients. That's what keeps me in business. But if I can get someone longer lasting pain relief, that's what we're going to do. That's how we practice. So I explain that to patients a lot of times. I say, listen, you're paying me anywhere between $40 to $100 a treatment, depending on what we're doing. And I explain to them, if you can get this pain cream at a reasonable price, which you guys offer it for, and this takes your visits down from 3 times a month to once a month for more of a maintenance protocol, that's fantastic. We're thrilled. And at the end of the day, they're saving money in the long run on that. I might be losing a little bit, but that's okay. If they're happy, they refer us people, and it works out on both ends. So we're happy either way. But absolutely, I can tell you firsthand, since we've incorporated the CBD, it has cut down on visits in our office. Now, we do a lot with CBD, so it all equals out. But at the end of the day, yes, these people are not in as frequently as they used to be because they now have an at-home way of management. Which I find is fantastic. Something else I'll say too, I see this a lot. We have CBD stores popping up everywhere in Buffalo. They're all over, all of the US at this point, I would argue. So a lot of people come in and say, hey, I tried this spray. I tried this one. It did not work nearly as well. And I emphasize all the time, listen, we have 500 milligrams in the 3.8 ounce on top of the arnica that's in there, on top of the emu oil, which there's some preliminary research showing that emu oil increases the bioavailability and the absorption of the CBD topically. Because remember, the CBD binds to your CB2 receptors on the skin and then penetrates those tissues to decrease inflammation. If we can increase the absorption and the bioavailability with emu oil, that's fantastic. That's longer lasting pain relief. That's better results. So all the time I have patients coming in, they're saying, well, I got this one. And I say, well, try this one real quick. Let me give you a little sample on your knee. And by the end of the visit, they're asking me if they can purchase here because it works. It works.
And at the end of the day, that's what we're looking for, right? We just want results. So I'm glad you're having such great success with our pain creams, pain relief creams, and also the roll-on. So thanks so much for that, Dr. Frank.
Of course.